Acute infection destroys the ciliated epithelium and it impairs the drainage. As a result, stasis of secretion invites the infection, and the persistence of the infection causes mucosal changes, submucosal changes, loss of cilia, and epithelial changes. Mucosa may undergo hypertrophy or atrophy. Submucosal changes are due to infiltration with plasma cells. There occurs fibrosis, abscess, polyps, or granulations. Epithelium can undergo metaplasia, regeneration, or resquamization. And it is a simultaneous healing and destruction process. Clinical features are purulent nasal discharge. If there is associated foul smell, it indicates anaerobic infections, and sometimes local pain and headache is also seen in acute exacerbations of the chronic sinusitis. Treatment is by conservative and surgical. Conservative treatment like antibiotics, nasal decongestant drops, steroids. Coming to surgical, for maxillary sinusitis, antral irrigations by passing cannula through the inferior meatus. Cannula is passed through the inferior meatus and antral puncture and irrigation. And a window is created in the inferior meatus. Window is created between the inferior meatus and the antrum for ventilation and drainage in intranasal antrostomy. As it is approached through intranasal, it is called intranasal antrostomy. And Cadwell look operation, here also the same window is created between inferior meatus and antrum, but the incision is in sublabium, that is sublabial incision. Then coming to the frontal sinus, trephination, that is horizontal incision is given in the superior medial aspect, and I already discussed in that in acute frontal sinusitis. And curvilinear incision is given in a medial aspect of the orbit. It's called Lynch or Howard's operation or external frontoethmoidectomy. And through this, a new frontonasal duct is created after extension of ethmoidal cells and diseased mucosa of the frontal sinus. And then osteoplastic flap operation is also indicated. Coming to ethmoid sinus, ethmoidal cells between the medial wall of the orbit and the middle meatus or middle turbinate are removed by intranasal approach. And other is external ethmoidectomy, frontoethmoidectomy. It is also called external frontonasal sphenoidectomy. And coming to sphenoid, external approach by external frontoethmoidosphenoidectomy or transseptal approach. Through these approaches, anterior wall of the sphenoid is removed. Apart from these infections, there are also fungal infections of the sinus, fungal ball, allergic and chronic invasive types, and fulminant. And the most common agents are Rhizopus, Aspergillus, Mucor. Mostly the treatment is by functional endoscopic sinus surgery.